Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips, and Practical Tips. Today, I'm going to share with you a very interesting and a rare occurrence of multiple intracranial tuberculomas. So this is a case of a 32-year-old female patient who presented with left hemiparesis, and a brain MRI showed multiple cystic ring-enhancing CNS lesions involving the cerebrum and cerebellum. And as you can see here, there are the multiple lesions seen both supra and infratentorially, which are enhancing, and the main differential diagnosis was actually metastasis with a lesser probability of neurocysticercosis. So this is the excised, one of the excised lesions that was sent for a pathological examination, and this is the scanning power magnification of the lesion. So on high power magnification, as you can see, there is a well-circumscribed lesion mass with inflammatory infiltrate and histiocytic proliferation and then necrosis. And on further high power magnification, the plasma cell-rich inflammatory cell infiltrate, the granulomatous reaction that is seen, many histiocytes, epithelioid histiocytes, and then necrosis. And this is a high power magnification of the necrotic area. And of course, in these circumstances, you have to apply the appropriate specialistines and sometimes even immunohistochemistry if in doubt of the presence of malignancy. And in this particular example, we were astonished when we started to see the acid-fast bacilli within the necrotic area, thus establishing the diagnosis of multiple intracranial tuberculomas. Now, going back to the patient and further investigating her status, there was no evidence of active TB in the case, and there was no evidence of immune suppression condition. So the patient was not actually on medications. She's not a known case of malignancy, and she does not have rheumatological disorder, for example, that would impair the immunity. So the final diagnosis of this case was multiple intracranial tuberculomas, a rare occurrence that we should be aware of, especially in areas where tuberculosis is more common, mostly in Asian and African countries. Establishing the proper diagnosis would mean that the patient would receive the proper treatment. And of course, we have to exclude the other important differential diagnosis, including malignancies, which would be the single most important differential diagnosis in this setup. I hope you find this tip useful in your daily practice. Thank you.